Hello, Pain Free for Life members, and welcome to the next Avazia Life Pinnacle training video. Today, we're going to be talking about treating scar tissue. This is one of the most important things that you can do with your microcurrent device, and I'm going to show you why. So this is rule number one. So when you're dealing with someone who has any problems whatsoever, you want to make sure you keep calm and follow the rules. Scar tissue is rule number one. Many of us have scar tissue in one form or another, whether it's from a surgery, an old injury, or even dental work. There's scar tissue throughout our bodies. It is what forms as our body is trying to rapidly heal an area. So even if you don't have what you would imagine to be scar tissue, you got to think about things like whiplash, tattoos, those sorts of things. Times when areas of the body are put under strain, like fractures, things like that. There may not have been a penetration where your skin is opened like a wound, but the body still fixes it with scar tissue on the inside. Now, this treatment is very, very easy to perform. It can yield huge results. It could be 50 or 60, even higher % of the problem that the person is experiencing. And so our first rule of microcurrent is to treat all scars. The one exception to this is if you are electrically sensitive. If you have in the past found that you have you might have some problems with being too close to a TV, or you might get headache in electric cars, or Wi-Fi really, really bothers you, in which case you need to start with the elimination assistance protocol. But otherwise, rule number one, treat all scars. Scar tissue can hurt. It can cause pain, but it has far more sinister ramifications on our body than just pain. So often more important than the pain and stiffness is the communication problem in the body. Though this may not be at the forefront of your mind, it is the major issue. And so when you talk about old scars, people will often say, it's never bothered me before. Why would it bother me now? But the truth is that this can be a gradual buildup that eventually ends up creating a chronic problem. Under normal circumstances, our body's tissue acts as a conductor. So electricity, the electrical signals in our body, pass through the tissue to get to where they need to go. However, these actions can be impacted and slowed by scar tissue. And this is a big deal because these signals can be as key as telling us that we're in pain to so that we need to stop doing what we're doing, to triggering the healing process. So turning off the pain, healing twisted muscles, or even broken bones are all done through electrical signaling. It's how our body turns itself on to repair mode. Now, scar tissue kind of goes against that. When you treat with scar tissue, or when you treat scar tissue, you need to be aware of sort of what type of scar tissue it is, and you need to treat it to neutralize that scar tissue. If you do not neutralize the scar tissue, then the body's communication problems will continue and chronic disease and illness will set in and worsen. So keeping that in mind, treatment is simple, but we have to choose in the Pinnacle which mode we're going to use. It's equipped with multiple programs for treating scar tissue. BlueRel X 77 Hertz, Sana Deep 77, and Sana Surf 350. So these are programs that have different uses in optimally neutralizing different types of scar tissue. So BlueRel X 77 Hertz is essentially used for normal scar tissue treatment for most scars. It can dose in zero and use reactions to unlock chronic scar blockages. Now, let's say, for example, that you are dealing with a normal scar, like a cut that you got that's just scarred across your arm. Then in that case, BlueRel X 77 Hertz is your key. 77 Hertz itself is the frequency that neutralizes scar tissue, and BlueRel X 77 Hertz gets to the surface, goes maybe an inch or so in, it's doing the stuff you need it to do. So you can use this, you can hold the device in place to do a dose and zeroing as per the dose and zero video, and this may be something you want to do if the scar is being stubborn. However, The simple way to do this would be to set your device and go to the second mode down, and that is your Blue Relax 77 Hertz. For most scar tissue, this is where you're going to want to go. Sana Deep 77 is used for deep scar tissue. This would be what I would consider surgical scar tissue that's been major surgery, right? Something like a hysterectomy, a C-section, any kind of ectomy is going to have resulted in some deep internal scar tissue. Now, Sana Deep 77, as you'll be aware from the Sana Modes video, has extra damping, which allows it to push the current deeper into the body and neutralize that tissue. Next is Sana Surf 350. Now, this is used specifically for keloid scars and thick, deep adhesions. So adhesions is often a result of a surgery as well, where the scar tissue has connected itself to organs and other tissues, kind of like think about like a room that's filled with spider webs, right? And those adhesions, being the spider webs, when you move, they can pull and create pretty bad pain. Sana Surf 350 is great for keloid scars and for these thick, deep adhesions. So you want to be using that mode if that's the case. But for most scar tissue, you're going to be defaulting to Blue Relax 77 Hertz or using Sana Deep 77 if you think it might be fairly deep in the body. Now, a combination of these scar tissue modes above is often best practice for ensuring that scar tissue has been neutralized and the collagen has been restored to normal conductivity. Remember, doing one treatment of this is enough, usually, to neutralize that issue and allow your body to restore communication. Now, breaking up the scars, that's a bit of a different story. So here's your basics for treatment. Locate the area where the scar tissue is and set your device to the required mode. So I'm gonna go for a demo here and I'm gonna do Sana Deep 77. So I'll turn my device on, flipping that switch on the side, and hold the button down until I find Sana Deep 77. And then I'm gonna hit the middle button to lock it in. Sana Deep 77 activated. I'll place it on the area where there's a scar. I'm gonna hold the plus button down until I can feel it. I want it to be a comfortable level, which means I need to be able to feel the current in my skin, but it shouldn't hurt. Okay, there we go. You can feel it. Now, you can move this around, you can hold it in place. Sana Deep 77 is fine for this. All of the scar tissue modes can be used. You want to typically paint over the scar because you can break it up. So you move over the scar with the electrode. It does not have to be the built-in. It can be something like the Y electrode or any of your other tools. So you paint over the scar for around 3 minutes. And if you feel like you need to get really deep, you can hold it in place for a few minutes as well after that. But make sure you paint it, get rid of any of those active zones that we've talked about. What about breaking up a scar? So some people want to go beyond the electrical neutralization and actually break apart the scar tissue and replace it with new tissue. This is particularly important if you're dealing with adhesions because these are causing you pain. Neutralizing them electrically might help your body heal, but the tissue's still pulling as you move. So if you want to do this, you're going to want to try using Sana Surf 350 over the area. You should feel a difference on a scar. You should feel softer after treatment. And with keloid scars with Sana Surf 350, they'll actually flatten out completely. Now, if after a few weeks you've not noticed a difference in the scar breaking up with Sana Surf 350, you want to set your device to blue stimulation and paint over the tissue daily for 3 to 5 minutes. Either way, whether you're doing Sana Surf 350 or blue stim, you're working for 3 to 5 minutes a day if you can. Now, the process of actually breaking up scar tissue takes a lot longer, but the major health benefits of treating scar tissue are to neutralize the tissue. Once it's been neutralized, a lot of the health benefits you're going to reap from that have already been reaped, and your body's going to be able to start getting better in that way. What about Sana Cycle and scars? So the Sana Cycle mode in your device has the ability to clear scar tissue as well during its cycle. And for original scar tissue clearing, it is still worth painting the device across the scar to ensure that none of it is missed. However, if you're going to be doing the cycle because you don't know what's going on, rest assured that Sana Cycle is spending some time clearing the scar tissue. So if you're not sure of the treatments you're doing, you're probably going to be using Sana Cycle to start, and you won't be missing out on this crucial treatment component. So do keep that in mind. Scar tissue neutralization can be accomplished with SanaCycle as well. Okay, thanks for watching. Treating scars should be your first major treatment.